The Canada health system is overall effective, but its health system still has some challenges needed to be addressed now. Canadian health system is working according to the figures shown here. Firstly, most expenditure are covered by public institutions who generate revenue from individuals and companies' tax. However, there are major gaps in Medicare, such as dental, vision, and other services, which explains the significant role of employer-based private health insurance and out-of-pocket payment. And there are several factors that could explain the impact they had on Canada's health system. One of the most significant factors would be the demographic issue. Canada is a large country with a small population, although as population has been growing, the problem of an aging population is becoming more acute, along with the increasing diagnosis on chronic disease and heart conditions. At the same time, Canada's dispersed housing situation exacerbates the problem of health inequality between rural and urban areas. Therefore, demographic issues will be one of the most serious and long-lasting factors affecting Canada's health system. Moreover, political and legal issues are two other factors that make a lasting impression on Canada's health care. Canada is a federation. The provinces and the territories administer health coverage system for their residents, called a Medicare program, and the federal government mainly expected to set national standards and also responsible for health coverage for specific subpopulations. However, as healthcare is predominantly publicly financed, with approximately 70% of health expenditure financed through the general tax revenues, the financial situation between different governments can indirectly lead to the problem of uneven healthcare in different regions. Moreover, inconsistency in the level of implementation of national standard at all levels of government will also lead to a waste of healthcare resources, and thus leading to a trend towards a greater administrative centralization by single provincial agencies in recent years. In addition, it was noting that new immigrants contribute to a large proportion of Canada's population growth, while Canada's new immigrants suffer significantly health disparities relatively to its original residents, and this has been attributed to the difficulty of accessing the full range of healthcare resources due to the language difficulties and unfamiliarity with laws and regulations. Moreover, primary care performance in Canada has been consistently weak, as measured by timely access to care and the use of electronic medical records. Thus, the lack of integration of patient information led to a major challenge to Canada's health system, which also led to an inefficiency for service delivery. Over the decade 2008 to 2017, Canada's health expenditure grew at a slower rate than the national economy. But there are signs of emerging growth in health spending since 2017. Although the rate continues to grow, the growth rate has slowed considerably in the last 5 years, and it is fair to say Canada's recent experience in terms of the growth of health spending as a share of the economy is similar to other OECD countries. So, for now, Canada's stable ratio of healthcare spending to the national economy result in less pressure to Canada's health system. Lastly, there are numerous factors adversely influence the health of Canadians, and cancer and cardiovascular disease are the two main causes of the deaths. The performance of Canada's health system can clearly show its performance comparing to other countries. Take US and the UK as a comparator. Canada's life expectancy is relatively longer. However, both its length of hospital stays and waiting time shows that it has a low efficiency in allocating health resources. Even the proportion of waiting time in Canada is reported to over 4 times longer than in the USA. Thus, here are some of the challenges that need to be addressed in the Canada's health care system. First one is the inefficiency of primary care. In Canada, GPs act as a gatekeeper, such as they decide whether their patients should obtain diagnostic tests, prescription drug therapies, or be referred to a medical specialist. And thus, their working quality can directly decide the following delivery of health services. While primary care performance in Canada has been consistently weak as measured by timely access to care and the use of electronic medical records, while due to the limited interoperability of information systems that challenge the sharing of patient information across providers. Thus, how to enhancing the correlation between all levels of services provider is the key issue that worth discussing. Moreover, as Canada is a country with large landscape while a relatively low population, thus the dispersed nature of population led to a low efficiency in health resource usage. Especially in rural area, their shortage of doctors, medical equipment, and even medicines has led to serious healthcare inequality. Another problem worth mentioning is the waiting time of its health services. Due to the imbalanced distribution of health resources and inefficient cooperation among different sectors, the waiting time to get a specialist treatment in Canada is far longer than in other countries. Thus, although residents in Canada have little pressure in healthcare payments, the long waiting time still struggled Canadians a lot. Lastly, as federal governments allocate funding to PNT governments mainly based on historical basis rather than their specific needs, a fragmented funding and the misaligned allocation of scarce health resources arise. Overall, Canada's health system performs with great satisfaction, while there are still few challenges which will be addressed in recommendation part.
For the organization, Canadian Medicare, which is Canada's universal and publicly funded healthcare system, was established through federal legislation. Canadian PNT governments may have primarily responsibility for financing, organizing, and delivering health services and supervising healthcare providers. At the national level, there are two governmental agencies' functions. Firstly, the Health Canada is the federal Ministry of Health, plays a key role in upholding of national standards for universal health coverage. Secondly, the Public Health Agency of Canada is responsible for public health, chronic disease control, and prevention. Now we introduce Canada Universal Coverage. The commitment of Canada's healthcare system is to providing universal coverage. This means that all citizens and permanent residents have access to medically necessary hospital and physician services without direct charges as a point of care. Universal coverage is a significant feature of Canada's health system. For the financing, there are public health insurance, private health insurance, and out-of-pocket payment to finance the health system. Each PNT public health insurance plan covers all medically necessary hospital and physician services. Those not covered under Canadian Medicare are largely privately financed, either from patient out-of-pocket payments or through private insurance. The funding source is general PNT government revenue. Most government revenue comes from taxation. About 24% is provided by the Canada Health Transfer, which is a federal program that funds healthcare for provinces and territories. For the provider payments, the hospitals and physician services are publicly funded, meaning that the majority of healthcare providers in Canada are paid through public funds. Patients typically do not directly pay for hospital stays or visits to physicians for medically necessary service covered. The fee-for-service is the primary form of physician payment, although there has been a movement toward alternative forms of payment, such as capitation and salaries, made up remaining payments. For the health service delivery, the primary care service as the foundation of Canada's healthcare system, providing patients with access to basic medical services, preventive care, and referrals to specialists when needed. The family physicians, nurse practitioners plays a key role in coordinating patient care and managing chronic diseases. Therefore, based on our analysis, we suggest the following 4 recommendations for Canada health system. Firstly, reducing health disparities across regions and populations in Canada. We need a comprehensive approach, such as investment in infrastructure, to ensure the equitable distribution of healthcare resources across all regions, which needs targeted investment in remote areas to improve access to care. Then, using telemedicine services, expand access to telemedicine in rural areas where access to healthcare facilities are limited, and using community-based healthcare models. Secondly, promote delivery system integration and care coordination. Canadian health policy and financing reforms are needed to incentivize integrated care delivery and care coordination, aligning reimbursement models with value-based care and promoting alternative payment models to support better collaboration. From current status, we need to promote more advanced electronic health records and health information exchange systems to address limited interoperability issue. Thirdly, using primary care to reduce health system costs. Canada health system needs to emphasize disease prevention and early intervention. as preventing diseases before they occur can significantly reduce healthcare costs with better chronic disease management in primary care. Finally, improving health system resource allocation, we need to create needs-based allocation, which means based on specific population health needs, demographic trends to allocate resources more effectively. Transparent funding mechanisms is also needed. We need to ensure transparency in funding allocation processes from federal to PNT government by making evidence-based funding criteria and allocation formulas. In conclusion, Canadian authority needs to ensure the innovation, sustainability, and effectiveness of a health system and improve patients' outcomes.